Our medical expert, Dr. Payal Kohli, joins us now to talk about two health stories making really interesting headlines this morning. Dr. Kohli, great to have you. She's an adjunct professor at Johns Hopkins and Duke University. Let's start with a new study showing peanut allergies down 40%. This is a remarkable. If you were down 5%, that'd be impressive. What happened here?
Extremely remarkable. Good morning to all of you. And this has really turned the medical community on its head, because for the longest time, for decades, in fact, we had been telling parents, do not give your kids peanuts, don't give them tree nuts, don't give them milk, don't give them eggs until they turn about 3 years old, because you're going to challenge the immune system. And then in 2015, there was a study called LEAP that came out that said to do the opposite. Introduce it early when the immune system is learning what's good and what's bad, and you can reduce peanut allergies by 80%. So after that study came out in 2015, the guidelines got revised in 2017. We're now looking in 2025. We've seen, as you said, a 40% reduction in peanut allergies. That's about 40,000 kids that would otherwise have gone on to develop peanut allergies that we avoided by giving them these antigens early.
So it's not about, I'm sorry, I have a really weird story. I'm traumatized forever about trying to get my infant daughter to eat peanut butter, and she swelled up and we had to take her to the hospital. I'll never get over it. So we're not introducing peanuts at an early age. What should parents be doing?
No, in fact, the opposite. You are introducing peanuts at an early age.
What did I do wrong then?
Well, so your daughter may have been sensitized for other reasons, because the idea here is kids that grow up in ultra clean environments get sensitized to everything. So they're more likely to have not just food allergies, but cosmetic allergies and other types of contact allergies. But really what all the guidelines have now said as of 2021 is starting at the age of 4 to 6 months, a tiny little bit of peanut butter on their lips. And maybe you want to do it gradually. So you don't want to give a big spoonful, as you might have done. Perhaps
just a little
on her tongue, a little bit of milk. And the problem here is that moms get confused because we're told breast is best, right? You want breastfeeding for as long as possible, but you really want to start introducing those food antigens so that the immune system doesn't overreact and think that they're harmful when actually there's something that it should be accepting.
That's fascinating. It totally flies in the face of everything that we were told for these past couple of decades, but it makes sense because even allergy shots, they're exposing the person to a little teeny bit of the allergen and getting your system, I guess, to fight it or to get used to it. I mean, it makes sense to expose your kids to peanut butter or peanuts. But it's so different, Dr. Kohli, than what we've all been taught. And of course, maybe Dave's daughter has a peanut allergy. Some kids will still have nut allergies, correct?
Right. Yes, exactly right, Allison. You're absolutely right. But the time to introduce it is early when the immune system is more plastic. So allergy shots often happen when we're adolescents or adults. And by that time, the immune system's already tired. It's not quite as flexible at learning. But even the idea of outdoor play having gone down is one of the reasons that we think that we have, more infections. This is something called the hygiene hypothesis, which they've now kind of expanded into something called the microbial hypothesis, which is that we need to be exposed to dirt, we need to be exposed to sick siblings, and we need to be exposed to these food antigens early when our immune system is learning what's good and what's bad. So what most pediatricians are now saying is that have your kids spend some time outdoors. When they're infants, have them crawl around in the dirt, have them be exposed to these food antigens. And perhaps if they get a cold, don't reach for those antibiotics so early, because you change the flora in their gut and you can actually make their gut less tolerant to other things that it's exposed to later in life.
I don't know if we have time to talk about the psychological impact that Dave's daughter feels now that she's a young adult, whether she eats with you, Dave, or does she just clear?
I'll never get over it. I felt like I was child abuse. Like I'll never get over it.
But I have to say a few things, Dave. Has she outgrown the allergy at all?
I don't know, because she won't get within 6 feet of peanut butter. We are not allowed to have it in the house, so I don't know.
But kudos to you for recognizing the signs, because I know my niece, she's allergic to cashews. Her parents gave it to her. It took them 30 minutes to recognize that something was really wrong when her face started swelling up. So it is a really good idea for parents to at least know, as they're introducing these types of foods, exactly what the signs are. And sometimes it can just be inconsolable crying because they're an infant. They don't know how to express themselves.
All right, Dr. Kohli,
Yeah.
thanks for joining us again. We appreciate it. Learn something new all the time with Dr. Kohli.
Absolutely.